All
Good, Brady. Okay.
right.
There you go.
All right,
We're on.
thank you. Welcome to Personnel Committee for Tuesday, January 10th, 2017. I'm Alderman Stoyer. I'm here. We got Alderman Slottick, and we have Alderman Dwayne. Alderman Moore is, hopefully will be here shortly. Adoption of the agenda.
So moved.
Second.
All right, all in favor?
Aye.
All opposed? That passes. Approval of the minutes from the December 13th, 2016
Move
meeting.
approval.
All right.
Second.
Do we have a second? All in favor?
Aye.
All opposed? I'd also like to mention that we have Alders Weary, Vanderleest, and Manning here, amongst others. All right. Next, number 4, consideration with possible action on request to fill the following replacement positions and all subsequent vacancies resulting from internal transfers. Do we want to take this one at a time?
No.
Take
Move
them
to-
take them together.
Okay, we'll take A and B together.
I'll move approval of A and B.
Second.
Okay, is there any discussion? Okay, all in favor?
Aye.
All opposed? Okay. Number 5, consideration with possible action on a request to reclassify the .5 limited term neighborhood support specialist position at $12.48 an hour to a full-time non-exempt neighborhood support assistant at pay grade 26, $16.35 to $20.02 an hour. Recommend approval to fill this position and all subsequent vacancies resulting from internal transfers. Thank you. The salary for this position will be funded 50% by the Green Bay Neighborhood Leadership Council and 50% Community Development Block Grant.
If there are any questions, Assistant Director Rennie Rodriguez here, and she could respond to them.
Cheryl, could you come forward and speak on the matter? Thank you.
Okay, so this is a position that currently is funded entirely part-time by the Green Bay Neighborhood Leadership Council. It's called the Neighborhood Support Specialist position. Neighborhood Support Specialist. It sounds like a sports specialist when I say it fast. What I'd like to do is have this position reclassified into a full-time position. It would not be on the levy. It would be funded by the Green Bay Neighborhood Leadership Council, and I got approval from them last Thursday to fund half of this position, which is an increase to the budget for that position. And then the other half would come from our Community Development Block Grant funds, because this position then, half-time would remain what it is, working with our neighborhood associations in Green Bay. The other half of this position then would be doing grassroots work with our neighborhoods that are low to moderate income and getting more input from those neighbors, which we really as staff right now don't have time to do that kind of in-the-field work. If you look at this map, this is a kind of a rude, sorry about the quality of the map, but the orange areas are what we call our Community Development Block Grant target areas. So these are considered low to moderate income neighborhoods based on the census tracts. There's over 20 neighborhood associations that actually land within these areas. So half of this position then with our block grant dollars would then be used to do more of that impact work in those neighborhoods. You know, do the neighbors want streets? Do they want lighting? Do they want houses torn down? Whatever that is, we could get more input from neighbors that live in that district. So it also stabilizes the position more. We've had some turnover issues. It's been hard to fill. At the part-time, lower salary position, it was $12 an hour. This, I believe, starts at $16.35, which is, I think, the lowest grade we have, which is a 26. So,
Well, Cheryl, I know, I appreciate the thoughts on this. What, before, I mean, how did you divvy that up in the office? I mean, you had how many different positions that somewhat covered neighborhoods, if you will? I mean, it seems like there's piecemeal with the number of the positions in planning.
for neighborhood association work?
Well, I suppose, I mean, because you worked with neighborhoods, you know, and inspectors work with neighborhoods. I guess I'm just trying to get a handle on.
Well, the part-time position that exists now strictly is Green Bay Neighborhood Leadership Council, neighborhood associations, their monthly meetings, mini grants, branding through Public Works, working with the neighborhood associations.
Now, would this person work only with the neighborhood associations?
No, because
Is there other
it would
areas
still be
that are not?
half-time, still would be half-time leadership council funded, so they would be working with the neighborhood associations. But that's what I like about it, is the other half would then be block grant funded. So it might not necessarily be a neighborhood association, but they would have to work within the orange areas on this map.
Okay.
Because that's the requirement of the block grant funds, is that we channel our money into these specific neighborhoods. So it would be anywhere where you see the orange, whether there's an association or not.
Okay.
They'd be working in. You know, we used to, when we did Navarino Park, for example, and the Navarino redevelopment, we would go into a neighborhood, we'd do, regardless of whether there was an association or not, and we'd gather info from the neighbors. We'd have sticky boards, and we'd look for priorities and those types of things, and we just don't have time to do that anymore. And we'd like to get back to doing that.
Okay, now, how many neighborhood associations are there right now?
43.
43, okay. And I know, would this person maybe help also to look at some of the associations that maybe aren't as active, maybe get more involved with them, or what?
Through their work, this position, the half-time, that's the block grant funding, that they could, I mean, if they're going into a neighborhood, like I think of a neighborhood, there's one in District 6 right now, that's on the orange section of this map, but there's no recognized neighborhood association. Maybe as a result of them working with the neighbors on park improvements, street improvements, whatnot with the block grant, that might come up to that level, but it's certainly not a requirement for the second half of the position.
Okay. Gentlemen, any questions at all?
Only because I know it's going to come up at council, and so you can get it into the minutes. There's aldermen that were saying, we're supposed to be separating Green Bay, the council, away from the associations. They're supposed to be going out on their own. And now we're bringing people in, we're going to be starting to pay for them. We're going the opposite way. Can you explain?
I don't know where that came from, and I don't understand that, but I know in other cities in the state of Wisconsin that there are designated city staff people that work specifically with neighborhood associations. So we haven't historically in Green Bay. We've gone private funding. There are benefits to that as well. And it will still be 50% privately funded, and then the other half will be block grant. So it will not be on the levy. This position won't be on the levy. My goal is to get a neighborhood staff person on the levy at some point in time. I know we're having tough budget times coming up now, so who knows when that will be, but I think as a city, we should be supporting our neighborhood associations.
Joe?
I'd like to be
We
upfront about that.
We just recommended this up at the RDA and asked that we have a report of accomplishments of that position at Joint Finance and Personnel when we start looking at the 2018 budget, to make a determination if it should be a funded position or if we can continue to fund it through these other means.
In all fairness, I don't expect that. I don't expect this to ask for this position on the levy next year because I know that this is a tough budget time, but.
No, I just wanted on the record for another alderman that asked me if he could
Yes.
make it, so.
Tom, do you have anything?
I noticed in the justification report, you said that this person is responsible for coordinating fundraising for Green Bay neighborhoods with over 1 million raised to date. Tell me about how they raise funds.
That would be the half will continue to be funded by the private dollars. We've done it any number of ways. We've done 3 capital campaigns to raise over that $1 million. The last time we actually formed, a fundraising campaign to support the Leadership Council and Neighborhood Association. So the last time we did the fundraiser, we built our own cabinet. We had a couple of leads, and then we just went out and made the calls.
Okay, so that raising of $1 million to date was over what period of time?
It's probably over the last, we've done every 10 years.
Okay, so that's the work of a number of these people over 10 years.
Yes.
Okay, thank you.
And we'll be starting another campaign, gearing up for one this year, at the end of this year, for next year, because we're at the end of the 3-year cycle, so.
I would make a
Well,
motion that we approve the
okay.
position and then just ask for the same report.
Okay, we have a motion. Do we have a second?
I'll second.
Okay, any other discussion? All in favor?
Aye.
All opposed? That passes. Thank you, Shirley.
Thank you, John.
Presentation by Human Resources regarding Health 1265.
Yes, we have with us today Meredith Bacek. She is the new wellness coordinator for the city. She's actually an employee of Bell and Health, but she works full-time with the city, so she's basically our full-time wellness coordinator. And she's going to give us a presentation. It really is an update on what has transpired or what happened last year under the Health 1265 program, and then what we're looking at for 2017. So with that, Meredith, if you would.
Hi,
Thank
Mary.
you.
Hello, Mary.
Hi, nice to meet you all.
Yes.
So Health 1265, we had some really positive results within this program for last year being the first year. There were over 480 employees out of 530 eligible that joined. So an 88% engagement rate among those who registered. That means 88% of the participants participated in some part of this program. 75% achieved the 1265 points, so that was the reduction in their insurance premium, and 62% achieved 635 wellness activity points. So those are activity points outside of the basic preventative exams that they do. There was also 68% achieving the activity goal of 125,000 steps. And that's the current steps taken right now. So it's increasing every day as we go. The 88% engagement rate is phenomenal. I came from another program too where an average of 45% engagement rate among employees is outstanding within an employee program, wellness program. So a lot of the information that I gave to those registering for Health 1265 is the reduction in their insurance premiums, getting the 1265 points. Everyone can get the 1265 points. There's a variety of options, which I'll go over as well. There's incentives being provided for those that are being engaged and active. And the 1265 points need to be earned this coming year by October 31st, 2017. So we've started the new program and the new rollout. With things from 2016 and now rolling into 2017, when I came in, we put together a panel of employees to kind of talk about what worked and what didn't work, pros, cons of the program last year in order to develop and make any changes that we needed to for the upcoming year as well. So some of the changes, one of the changes would be on the prevention section. We kind of talked about there was kind of a big differential between the top HRA score and the bottom HRA score. So what we did is instead of the 600 points for the top HRA score, we brought it to 400, knowing that they, one, have a year now to gain points, but then two, just noticing that those people in that top HRA score are probably the ones that are going to achieve well beyond the 1265 points. As for wellness activities, here's some of the activities. The biggest goals this year are movement, nutrition, and then disease management. So employees have the opportunity to participate in smaller programs throughout to gain those points for their scorecard. One of the things here that the panel talked about was increasing the monthly goal steps. So we're trying to increase it further and further, closer to that national average, which is actually 10,000 steps. So we're taking the baby steps there, but definitely an increase is needed. Self-reported workouts, participating in community events, and also wellness challenges. I'm currently going to be starting the first one, which is going to be in the winter, a goal of 250,000 steps in 6 weeks. The nutrition side, we have some presentations coming up. Festival Foods is going to be presenting, as well as a weight management challenge. We just finished Freeze the Gain. We had 540 pounds lost out of the 216 participants. So it was an average of 3 pounds per participant. And 91% of the people stated that the program definitely helped them maintain with their maintain and lose goals. And then the healthy choices. The panel talked a lot about financial stress being one of the things that we want to bring awareness to. So Wells Fargo is coming in to do a budgeting and financial stress seminar. It's free. And same with the guy nurse is coming in as well as the professional patient, community volunteering, and then just the basic surveys and the things for disease management, like the flu shots, the smoke-free campaign as well. And then the incentives. So these are the incentives, the PDA dollars that employees can get for doing their HRA exams or preventative exams, their dental cleanings as well. And along with that, we have incentives, and the panel talked a lot about keeping people motivated throughout a whole year of this program. And so this year for the incentives versus last year is that they will be on a tier. So each tier that they reach, they're eligible for different prizes along the way. With $12.65 being the reduced insurance premium, and then going up from there. And the insurance premiums, they haven't changed, so they're going to be staying the same for this next upcoming round of Health 1265. That's all I got.
Okay.
Any questions?
John, any
You
questions?
bet.
Great.
Appreciate it.
Thank you.
Mary.
So much, Meredith.
All right,
Thank you, and you're welcome to aboard.
welcome on board.
Make
yes.
a motion to receive and place on file.
Do we have a motion? Do we have a second?
Second.
Okay, second by Tom Slavic, all in favor?
Aye.
All opposed? Thank you, that passes. Number 7, consideration with possible action on 2017 schedule for personnel and finance committee meetings.
Move to approve.
I just looked at it quickly, I have no
Yeah.
issue with it either.
Well, if we have a problem, we can always switch them.
Right.
That's
Okay,
the easiest way, at least we're on schedule.
okay. Is there anything there
Second.
that's, okay, we have a second by Tom Slavic, all in favor?
Aye.
All opposed? Okay, that passes. Number 8, consideration with possible action on report of routine personnel actions for regular employees.
Move to receive and place on
Second.
file.
Okay. Any other discussion, all in favor?
Aye.
All opposed? That passes.
Move to adjourn.
Okay, do we have a second?
Second.
All in favor?
Aye.
All opposed? Thank you all. I'll let you do it.